In this video, I'm going to discuss running with Achilles tendonitis or tendinopathy. And we'll just do a quick recap of what happens in your tendon when you've got a tendinopathy or tendonitis. Then we'll look at your symptoms that you may be experiencing and what do they mean? What do they tell you about your tendon? Then we'll take a look at running and why running may aggravate your tendon and how to adapt that. And we'll take a look at how to use your symptoms and changes in your symptoms to decide whether running is safe for you or whether you should actually stop running and allow your recovery. And then lastly, we'll take a look at if you have a really important race coming up and you really want to finish it, how you can get through it even though you've got Achilles pain. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com. where you can get online physiotherapy assessment as well as treatment of all your Achilles injuries. Have a look at the description of this video if you want a link to our website. What happens in your Achilles tendon when you have Achilles tendonitis or tendinopathy? Now, Achilles tendonitis is an overuse injury, and it happens when either you do a training session that's a lot harder than what the tendon can withstand, so you overuse it in one session, or you do not allow enough recovery time between hard training sessions. It's normal for us to accumulate or to get micro damage in our tissues, our joints, our muscles, our tendons when we train. But then the body uses the hours after training to repair that damage. And that's how we grow stronger. If over a period of time you don't allow the body that full recovery cycle and you train again before you're fully recovered, the micro damage accumulates, and that then causes an overuse injury like Achilles tendonitis. If you look at that portion of the tendon that's injured, because it's not the whole tendon that's affected, it's usually just part of it, you'll notice that the fibers in that area doesn't quite look normal. They no longer have their lovely parallel orientation. They're a little bit further apart, and that part of the tendon loses its strength. Not all of its strength, but some of its strength. So depending on how long you've had this injury for and how long it's been dragging on, that will affect how much strength you lose. So now, even if you do your normal running volumes or the things you could usually do, the tendon can't cope with it. And that's why it's making it more painful. What symptoms can you get when you've got Achilles tendonitis, and what can you interpret from your symptoms? The two main symptoms you get is either pain or stiffness. Now, some people have just pain, some just stiffness, and most often people feel a combination of it. And the stiffness may be more, the pain may be more, it's different for every person. Now, if we look at pain first and what the pain you feel in your tendon means, we used to think that the more painful something is, the worse the injury is. But we know now that actually pain is a very poor indication of how severe your injury is. There's a research study that came out either this year or last year, I'll link to it in the description of this video, where they looked at patients with Achilles tendon pain, and they looked at the severity of the pain versus the structural damage in the tendon. And what they found was that for some people, they had no pain, but they had a lot of damage in the tendon, whilst others had very little damage in the tendon, but they had really severe pain. And this feeds into what we've seen with other injuries over the last few years, that actually pain is not an indication of severity of injury. Pain is just an alarm system. So it's the body's ability, or the way the body tells you that there is something wrong in an area and you need to take note of it. Now, the pain system can become hypersensitized and supersensitive, that things that shouldn't be causing pain also triggers the pain. And it can be affected by things like your thoughts, your feelings, how long you've ignored it and just trained through the pain. Every time you push through it, the more sensitive it becomes, so the easier it becomes to aggravate it. Your thoughts, your feelings, what else can affect it? There are loads of different stuff that can affect how sensitive the system is. And we'll talk about it a little bit later as well. So the thing to remember about pain is, yes, it can indicate an injury, but sometimes it's not even linked to injury. But it doesn't tell you anything about the severity of yours. Now, what about stiffness? What does that tell us? There isn't really any research on this when I searched for what can we interpret from the stiffness you feel in your tendon. So I'm going to tell you what we observe in our patients. what we find is that as patients recover and they progress with their rehab, the stiffness usually starts to dissipate as well. If they overdo a session and they aggravate the tendon, the stiffness usually increases. So we find that stiffness is a good way to help you monitor your training volume to see if it's actually changing and if we're seeing positive effects. And it can be take a while, several weeks of training with your Achilles rehab before you start seeing improvements in the stiffness. But usually when we see that, we get really excited because then we know we're really on the right track with it. So if pain and stiffness isn't directly linked to severity of injury, does this mean that you can just run through it and ignore it? No, it doesn't. First of all, because it may mean that you're making your injury worse. We do see that in certain cases. And there is evidence also that if you neglect your Achilles tendonitis and you keep on training through it and continue to train it and don't strengthen your tendon up through rehab, you may end up rupturing your tendon. So that's the first reason why it's not good. The second is, remember I talked about the alarm system and how that can become sensitized. Now, how that works is the more you push into pain, the more you aggravate it, it becomes easier to trigger it. So in the end, even just things like walking to the shops or getting out of bed in the morning can really cause severe pain and start to really influence your life. And it may mean that you have to give up all running if you continue to push into it and make it super sensitive. So it's not really useful to just keep on pushing into it. How can you adapt your running to still allow tendon healing but continue with some running? Think back when we spoke about what happens in the tendon. So that part of the tendon is now injured and it's lost some of its strength and endurance. So it won't be able to cope with your full volume or intensity of running. But it will have a capacity to likely cope with some. Not everybody. Some people have to give up running for a short while. But lots of our patients can continue to run as long as they run within the new capacity or the current capacity of the tendon. So ways in which you may be able to adapt your tendon, that you bring the load down, that the tendon is happy with it, is cut your running volume. So don't do such long runs, shorter runs rather. Perhaps also look at the frequency of your running, because you have to figure into it that you've also got to be doing your strength training exercises. And if you're doing a full running program plus strength training on top of it, all of that counts towards the total load through the tendon and can cause it to overload. So your strength training is the most important thing during this process, because that's going to be the thing that restores the strength in the tendon and shouldn't be neglected. So then you build your running around that to not aggravate it. Then things like cutting out high intensity training sessions like hill sessions or speed sessions. The faster you load the tendon or the harder you have to push through the calf to get you up a hill, the more load goes through it. So just sticking to easy runs and not fast running may already be enough to allow you to run while you recover. But how can you know that the way you've adapted your running is enough to allow your recovery to happen? We tend to teach our patients to use their symptom response, and this applies not only to running. You can apply this method to your rehab exercises as well, because if your rehab is too heavy for you, it can also aggravate your symptoms and your injury. Now, what we're looking at is we're looking at both pain and stiffness, and we're not just looking at the immediate response while you're exercising. You have to also monitor the 24-hour response, because typically what tendons do is they feel fine or they even feel better while you're running, just to then really flare up several hours later or the next day even. So you have to check how does it respond in the next 24 hours. When you have an Achilles injury, you will have some pain and stiffness, or pain or stiffness, one or the other, regularly, regardless of whether you run or not. So you want to first establish what is your baseline of symptoms. How much stiffness do you normally have? How much pain do you normally have in your tendon if you don't do runs? So take note of that for a few days. Usually best to look at your symptoms that you feel first thing in the morning, those first few steps. How long does the stiffness last for? How intense is the pain? How long can you walk before your pain sets in? All of those things. So monitor that. Now, when you do a run, we want to look for changes in the symptoms you would normally feel. So a run is usually seen as okay if it only increased your pain slightly, never more than 3 out of 10 intensity, either during the run or in the 24 hours after the run. And that increase in symptoms should settle down really quickly. So within 24 hours, it shouldn't take longer than that. Same thing for stiffness. If you wake up the day after a run and your Achilles tendon feels significantly more stiff that morning, first few steps, that's usually a sign that whatever you did yesterday was a bit too much. And it doesn't have to be just your run. It can be also what other exercise you did in that day or activities, or even the previous day, that it was the cumulative load. And your physio will be able to help you figure this out, because they've got to look at the load through all the activities you do in your week and figure out the best program for you with regards to that. So a run is okay if it's only slight increase in symptoms and it settles within a day. It's not okay if it's quite a significant increase in your symptoms and it lasts for more than a day. So if you wake up the next morning and it feels a tiny bit more stiff than yesterday, but then by the afternoon it's fine, and the day after that the morning feels okay, that run was likely fine. If, however, it's significantly more stiff and now things are a bit more sensitive for 48 hours or so, that was likely too much. You may be monitoring your symptoms according to these guidelines, and your runs never really pushes the symptoms up much. But at the same time, you're not able to progress with your rehab. You're not seeing any changes in your pain levels or your symptoms going along. If that's the case, it may be worth cutting out running for a couple of weeks so that you can really observe, how about if I just do my strength training program and I don't run? Do my body then is my body able to then better recover from my strength training, and does that allow my symptoms to settle? So I have seen that in some patients where there's no clear indication that the runs are actually causing trouble, but then when we get them to stop running, they finally make progress. And I think the reason for that is that although that run isn't too much, it's just that the body, with all the load, with the strength training included, is struggling to recover enough between the training sessions. What if you have a really important race coming up and you just want to finish it? You really want to take part. Now, typically I get emails from people saying they are doing this marathon in memory of a loved one who passed away of cancer, and they've got all these sponsors and they really just want to finish it. Now, if that's the case, there are some things that you can do to get your Achilles pain to calm down in training and allow you to finish that race. But I have to say, these things will not protect your tendon. It doesn't mean that you won't make your injury worse. You may make your injury worse if you finish the race with Achilles pain. And lastly, you may increase your risk of rupturing your Achilles tendon if you keep on training through pain. But there are certain things that I've helped my patients with in the past that's allowed them to actually finish races with very little pain and not be worse off afterwards. So some of the things include the following. If you're still training for your marathon or your race and your tendon becomes painful at that point, depending on where in your training plan, you may do different things. So the first thing is not to stick to your program like a slave if you have Achilles pain. If you're due for a very long run this weekend, but your tendon is painful, you're going to look for trouble if you go do that long run. It's better to really cut the running volume, shorter runs, whatever you can do that doesn't cause an increase in your pain. It may even be that you walk the distances rather than just run it, and cross-train to keep your fitness up. Then the other thing that you can do is you could place heel lift orthotics, just like heel cups, into your shoes to lift your heel a tiny little bit, because that can take some of the strain off the Achilles tendon as well. But then on race day, you will have to adapt your goals. You will not be able to run that race as quickly as you wanted to. You may not even be able to run the full race. You may have to use walk-run sections where you walk a bit, run a bit, walk a bit, run a bit to get through the race. So that's quite important. If I can give you an example of somebody, a case that just popped into my head. I remember this person was training for the Beachy Head Marathon. Now, Beachy Head Marathon is one of the hilliest marathons you can get in the UK. And his tendon became really painful about 2 weeks before the marathon. So he had already put all the training in, he's got the endurance in his legs, but now 2 weeks before the race, he's in agony. So what I told him was, well, we know that you're fit enough to finish this race, but we need to get your tendon to calm down and recover to the extent that it can. So I told him to just stop running at that point. He could cross train if he wanted to, but not run. And that allowed the tendon to calm down. And you know what? He finished that race. He did run walks, so he didn't try to run at all. He adapted his goals. And he didn't have any tendon pain while doing it. He did come and see me afterwards. The tendon wasn't really that sore. He just had a bit of stiffness so that we could rehab it properly then before he went back to running. But that was a classic case of if he had gone into panic mode and still did his last long run and still did more runs, he would have just irritated that tendon further. But because he was quite aggressive with how he allowed it to calm down, maintain his fitness through other measures, he was able to then get going with the race, and it wasn't an issue. The other important thing is, I quite often see people make the mistake that when they get Achilles symptoms while they're training for the marathon, they think, right, now I've got to strengthen this tendon while I train for the marathon. That's a massive mistake, because if you're going to start doing strength training exercises that also load the tendon plus your normal training regime, you're just going to overload it further. It may be that you have to do some exercises, but it may have to be very specific things like isometrics rather than the high load stuff. Because otherwise, and it may also be that you have to adapt the training that you do or how often you do your running training to accommodate that. A physiotherapist will help you assess this and can help you figure out what the correct exercises is. But please don't just take a program from the internet and go, right, they say high load exercises, I'm going to do this with my training, because you'll very likely just overload it. Hope you found that useful. Now remember, if you need more help with an Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.